Hello, this is Tyler White with Survivopedia. I'm going to talk to you today about the Survival MD book. First, we're going to start out on page 82, and basically we're going to talk about how to treat a bullet wound. This is a major concern in an SHTF situation and something that you really need to be familiar with before it happens and not afterwards. So on page 82, it talks a little bit about the very first things you do after someone has sustained a bullet wound. It's going to talk about dealing with airway, breathing, circulation, disability, or checking for movement of the extremities to see if they're functioning, and the exit wound. Also talks about tourniquets that are being created on the go. And it also kind of discusses, tourniquets have a bad rap in medicine lately, but the last few decades of war, tourniquets have come back into favor as a way to maintain blood volume until help from a doctor or hospital can be obtained. So let's talk first off, what do you do if you get shot? Well, that depends. It depends on the location, and it depends on the severity, and it really depends on did they nick an artery. So one of the first things that I would go to always is a tourniquet. Now, yes, in the book it talks about how you can make them, but with just a little bit more preparation, you can actually have them on hand. This is one of the tourniquets I used in Afghanistan. It's a cat tourniquet. And it is pre-prepared so that all I have to do is open it up, throw it on, crank it tight. And all I've done to make that happen is I've opened it its full extent, I fed it through, and about the length of it in 1/3, I've folded over. Now all I need to do is just fold that down. And it gives you this handy little packed setup, so that all that you need to do if something happens is open it, slide it on. You can grab this little tab, which is red, yank it tight with one hand, and give it a crank. The basics, if you've got an actual tourniquet, are first prep it so that it can be used. I also sometimes like to fold over this red tab so that it's just dangling. So when I do fold this main thing over, when it comes time to open it up, I can grab that red tab and pull on it so it doesn't stick to itself. Kind of like how you fold over a piece of tape before you put it away on a roll. It used to be if you used a tourniquet, you were going to lose the limb. With today's modern technological advances, we can deal with sepsis and we can deal with the death that occurs in that limb not coming back and affecting the body. That used to be something we had a problem with. So tourniquets are something that you do not be afraid to use. If I get shot right here in the arm and it's squirting blood, I'm going to put the tourniquet at least a couple inches above the upper joint. If it's here, I put it 2 inches above the joint. I don't want to put it right barely above the location because veins have a tendency to contract like rubber bands. So if I get shot here, this is the next joint and I go 2 inches above that, that's fine. That's the location that it's going to be. Same thing with the leg. Don't put it right on a joint because the joint will create a bone archway that keeps the blood vessel from being compressed. Go at least 2 or 3 inches above the injury, and if the first one doesn't work, put another one on. So tourniquets, yes, they can be made from belts and they can be made from other things. They are substantially less effective when you do that. It doesn't cost very much for you to just buy a tourniquet and have access to it. If you carry a firearm on the regular, you should carry a tourniquet on the regular and a medical kit. Oftentimes that tourniquet and med kit will come in more handy than the firearm itself when it comes to preparing against SHTF. Now I've got a kit that I keep in my car. It's got a tourniquet on the outside of it. It has been beat up substantially. I need to upgrade this kit. But one way that you can set this up is have different things in different compartments. As an example, I've got a SAM splint right here, quick reference, and I can get a hold of it quick for broken bones. If you just open it up, each little compartment is dedicated to a specific cause. Some of the other stuff that I keep on the outside are airway, which he talks about. Right there is an air mask. You want to always have body substance isolation. Put gloves on, put a mask on. If you're dealing with someone that's not a family member, or in my case, a soldier that I know doesn't have a disease, you want to protect yourself. You cannot help them if you hurt yourself. So CPR masks, body substance isolation is important to have in your kits. Moving past that, when it comes to stopping a bleeding situation. If it's somewhere in the lung area, it's most likely going to be a sucking chest wound. The way that we deal with the sucking chest wound is we either take if you want to do it the home remedy way, you take a chunk of MRE, outer or plastic or something, put tape on 3 sides. If I get shot on this side, I have that side down with the vent on the bottom. And essentially, if I've got a hole, I put the plastic over it, tape, and tape, with the bottom side down so that when I inhale, it seals against it. You can use Vaseline as well. And when I exhale, it burps out and pushes the blood out. That gives my body the ability to expand that lung again. If you do have a sucking chest wound, if it goes in, it usually comes out. If you don't seal off the front and the back, the diaphragm won't be able to create the negative pressure required to inflate your lungs. Lungs aren't muscles, they're just sacs. So essentially what's happening is you're expanding that, creating a negative pressure, and your lungs fill up with air. And if there's a hole, air goes in through that hole instead of creating the negative pressure to expand the lung. So you can breathe all you want, but that lung doesn't actually expand and get air. So essentially, to deal with the sucking chest wound, we plug it off so that when I inhale, it pushes against it and it creates a valve. And then when I exhale, it burps out that extra little bit of air. Now when it comes to deal with a hole maybe in an upper leg, definitely hit it with the tourniquet somewhere in the guts. We want to pack the wound. The way that we're going to pack the wound is we're going to grab gauze first and foremost. You'll grab the gauze, you'll put one thumb in, put another thumb in, and just keep packing it. You want to pack to the bottom of the wound and all sides of the wound, filling it up with as much gauze as possible before putting some sort of a pressure bandage on the outside. When you add the pressure bandage, you're essentially pushing pressure down so that gauze inside of the wound expands and pushes against all of the potentially cut open arteries that you're trying to get to stop bleeding. If you have something like C-lock or some sort of hemostatic bandage that has a chemical that will bond with the blood to keep it from bleeding, put that in first. Follow it up with gauze, add a pressure bandage on top, and you're golden. So as a recap, there's really 3 or 4 ways to deal with gunshots. If it's in the extremity, tourniquet down fast. If it's in the lung and you've got some sort of a deviated trach, you're going to have a sucking chest wound. Use a Vaseline patch that has 3 or 4 or 3 sides or 2 sides sticky, and lay the victim on a side so that the stuff that's coming out can bleed away from them, not inside of the cavity. If there's an entry hole, there's going to be an exit hole. And when it comes to guts or any other shot spot, pack it with gauze, put pressure bandage on the top, use the hemostatic bandage if you have that first, and get them to the hospital. All right, guys, so hopefully this is valuable to you. The book goes into depth with many other topics. And this is a really handy book because it gives you the ability to just bust through the index right here in the front. Why preventative medicine, specific disease preparedness, dental preparedness, which is substantial. A lot of people will die from infections because they don't deal with the dental preparedness. Preparedness for women, sanitation and hygiene, that's very important. A list of medications to stockpile, I really like that one. Medical response kits, they kind of go into depth on that. Alternative medicine, emergency sanitation, what to do if there's no water, medical emergency protocol, understanding CPR, broken bones, non-infectious diseases, and so forth. Hopefully that's valuable to you. If you're interested, go pick one of these up. Survival MD, What to Do When There's No Doctor. Very outstanding book. I'm digging it through myself. Okay, thank you for watching.